Hey everybody, today I want to talk about something that we may kind of shy away from. I want to talk about, bruh,
I'm telling you, bruh. Man, it's 2025, dog. Ain't nobody trying to hear that word in 2025. You see what they doing?
I want to talk about,
Bruh,
why are you doing this?
you can't do that in 2025. I know what you want to be, who you think you are. Advocacy. Might want to chill, bruh. Might want to chill. But hey, listen to me. Listen to me. Nah. I got an idea. If you want to say it, put some kittens on the screen. People love cats. Love cats. Do that. If you do that, you be straight.
For real? Okay. Today, I want to talk about racism.
Many Americans have decried racism as a scourge in American society. Now it's also a serious public health threat, according to the nation's largest federal health agency.
Racism has just been declared a public health crisis.
And now
Addressing disparity created by racism is an important first step in tackling racism as a public health issue.
If you're watching this video, you probably already know what I'm about to say. Let's be real for a minute. And you know what's wild? Every time we talk about health disparities, income gaps, educational inequality, social justice, environmental justice, there's always this dance, this careful tiptoeing around the elephant in the room. We use terms like socioeconomic factors, historically underserved communities, under-resourced or systemic barriers. And look, I get it. These terms they're not wrong. They're pretty accurate. They're professional. They're what we put in our grant applications and policy briefs. But today, we're going to call it what it is. It's racism. Plain and simple. I can end the video here. When we see that Black and brown mothers are 3 to 4 times more likely to die from pregnancy related to complications compared to white mothers, regardless of education or income level, that's racism. When we look at how our Latino communities are more likely to live in food deserts with limited access to fresh produce and healthy food, that's racism. And when we see Native American reservations lacking basic infrastructure for clean water, that's racist! Now, I know what some of you all are thinking. Corey, it's more complicated than that. There are multiple factors at play. And you're right, but here's the thing. All of these factors, they're branches from the same tree. Redlining led to environmental racism. Environmental racism led to health disparities. Health disparities led to shorter life expectancies. And the cycle continues. For my public health folks that are out there, you know how we talk about social determinants of health? Well, racism is the social determinant of social determinants. Think of it as Dr. Doom to the Marvel universe, right? And for our social workers and community advocates watching this, y'all are on the front lines. You see it every day, the way these systems work together to maintain inequality. When we name it, when we explicitly call out racism, something powerful happens. Suddenly, we can't hide behind euphemisms anymore. We have to face it head on. When we say poor communities lack access to healthcare, it suggests poverty is the root cause. When we say racism creates and maintains barriers to healthcare access, we're naming the system that created and maintained that poverty. We're in a unique position. We're the ones writing the reports, designing the programs, implementing the policies. We have the power to name it. And when we name it, we can fight it. We can design interventions that address root causes, not just symptoms. We can create policies that explicitly tackle racial inequity, not just disparities. Look, I know this isn't easy. Naming racism makes people uncomfortable. It can put your job at risk. It can make funding harder. But you know what's harder? Watching our communities continue to suffer because we're too afraid to name the problem. But there's good news. It's already happening. More and more organizations are explicitly naming racism as a public health crisis. More institutions are conducting racial equity audits. More funding is being directed specifically to address racial inequities. But as you all know, we need more. We need every public health professional, every social worker, every community advocate or community health worker, anybody in the healthcare system to be willing to name it, because when we name it, we can change it. So next time you're writing that report, designing that program, or advocating for your community, ask yourself, am I calling a spade, or am I dancing around the truth? Because racism, by any other name, is still racism. If this resonated with you, hit that subscribe button, share this video with your colleagues, drop a comment below, and share how you're naming and fighting racism in your work. My name is Corey Dion Lewis. I'll holler at you next time.